Hello, my friends. I'm Dr. Susan Parker, urologist and men's health specialist. And today I want to talk to you about something very simple that most men overlook. The first 10 seconds of your morning. For years, many men have been told that losing stamina, energy, and confidence is just part of getting older, as if the body suddenly forgot how to perform after 50 or 60. But that idea is not only discouraging, it's also scientifically wrong. Your body does not lose its potential. It loses the daily signals that keep that potential awake. And one of the most powerful signals you can send happens in the first moments after you open your eyes. In this video, I'm going to explain a very specific 10-second morning habit that supports circulation, male stamina, and daily vitality in a way that is simple, natural, and completely safe for most men. I'll show you exactly how to do it, why it works inside your body, and how men who combine this tiny ritual with a few smart habits often notice more stable energy, better control, and renewed confidence in their day and in their intimate well-being. This is not a magic trick, and it doesn't replace medical care. It is a practical tool you can start using tomorrow morning to support the systems that make stamina possible. Before we go into the habit itself, let's talk about the real problem. When men tell me, "Doctor, I just don't have the stamina I used to have," they are usually describing a combination of several things. They wake up tired even after a full night's sleep. Their legs feel heavy on the stairs. Their mind needs more coffee to turn on. In the evening, they feel drained, not motivated. And in their intimate life, they notice that endurance, firmness, or desire are not what they once were. They often blame age, but what I see again and again is a deeper pattern. Slow circulation, overloaded nerves, and an exhausted stress system. Your heart may still be strong. Your hormones may still be within a normal range. Yet the small blood vessels that supply the pelvic area, the muscles at the base of the body, and the nerves that coordinate them all are receiving mixed messages. Chronic stress, poor sleep, late-night eating, alcohol, sitting for long hours, and inactivity all send the same signal. Conserve energy. Shut down. Stay in survival mode. When your system lives in that mode for months or years, stamina naturally falls. Not because the body is broken, but because it is obeying the wrong instructions. Now here is the part most men never hear. The first few minutes after you wake up are like a software update for your nervous system and circulation. Your brain is moving from night mode to day mode. Your blood pressure is adjusting to the demands of movement. Your hormones receive an early briefing that will shape how they behave over the next several hours. If you spend those first seconds in automatic stress, rushing, checking your phone, tensing your body, you reinforce the pattern that drains your stamina. But if you use those same seconds to send a different signal, you gently push your system toward better oxygenation, better circulation, and calmer, more efficient nerves. This is exactly where the 10-second morning habit comes in. I call it the stamina switch. It is a very short, focused combination of breathing and muscle activation you do before you stand up from bed. It takes 10 seconds. It requires no device, no supplement, and you can do it at any age. Done consistently, it acts like a daily micro-workout for the deep structures that control male stamina. The pelvic floor, the lower abdominal wall, the diaphragm, and the blood vessels that supply the pelvic region. It is surprisingly simple, but it is not random. Every part has a purpose. Here is exactly how to do it. When you wake up, resist the urge to grab your phone or jump out of bed. Instead, lie on your back or sit on the edge of the bed with your feet on the floor. Relax your shoulders. Now, inhale slowly through your nose for a count of 5, allowing your abdomen and lower ribs to gently expand outward, like a balloon filling with air. Do not lift your shoulders. Let the breath go deep. Then, exhale gently through your mouth for a count of 5, and during that exhale, lightly contract the muscles at the base of your body, as if you were stopping urine midstream, and draw your lower abdomen slightly inward. After those 10 seconds, you can breathe normally and continue your morning. That's the habit. This may sound almost too simple, so let's unpack what just happened inside your body. During the slow 5-second nasal inhale, you recruited your diaphragm, the main breathing muscle that sits like a dome under your lungs. When the diaphragm moves downward, it creates a gentle vacuum in the chest, drawing blood back toward the heart more efficiently. At the same time, the deep breath encourages your body to release small amounts of nitric oxide, a natural compound that helps blood vessels relax and widen. Wider, more relaxed vessels mean better circulation, including to the pelvic region, which is essential for male stamina. Now, consider the second half of the habit, the 5-second exhale with pelvic floor engagement. When you gently squeeze the muscles you would use to stop urine, you are waking up a muscular network that wraps around the base of the pelvis. These muscles help control urine flow, support the prostate, and stabilize the structures involved in intimate function. Most men never train these muscles consciously, so they gradually weaken with age, surgeries, or long hours of sitting. This weakness can translate into reduced control, diminished endurance, and leaks when you cough or strain. By lightly activating them each morning while the blood vessels are opening, you send extra circulation to the exact area that often needs it most. But the benefit is not only mechanical. The coordinated pattern of slow inhale and controlled exhale also sends a message to your autonomic nervous system, the part of your brain that runs in the background controlling heart rate, blood pressure, and digestion. Fast, shallow breathing tells your system, "We are under threat," and keeps you in a stress-dominant mode that steals blood away from the digestive and reproductive systems. Slow, nasal, diaphragmatic breathing tells your system, "We are safe." This shift allows more blood flow to return to the organs that support digestion, hormone production, and intimate well-being, creating a quieter baseline from which stamina can emerge. When you repeat this 10-second habit every morning, you are not just doing a breathing exercise. You are teaching your body a new pattern. Over time, the pelvic floor becomes more responsive. The lower abdomen learns to coordinate with the breath instead of bracing unconsciously. Blood vessels in the pelvic area become more accustomed to opening fully at the start of the day. Many men notice that they feel warmer in the lower body, stand up from bed with less dizziness, and feel more present rather than scattered. These subtle changes accumulate, and in a few weeks they can translate into better endurance during walks, more stable energy through the afternoon, and greater confidence in intimate moments. Let's look at how this affects daily energy first. When you start the day by pulling a deeper volume of air into the lungs and helping venous blood return to the heart, you improve oxygen delivery to your muscles and brain. Oxygen is the fuel your cells need to produce energy. Many men who report low stamina are actually living in a constant state of underbreathing. Their fast, shallow breaths trick the body into thinking there is a shortage of oxygen, which maintains a low-level alarm inside their nervous system. The 10-second habit interrupts that pattern as soon as you wake, reducing the internal alarm and supplying a richer dose of oxygen before you even take your first step. Now think about circulation. Men often focus on the large vessels like coronary arteries, but stamina is heavily influenced by the small, delicate blood vessels that reach into muscle fibers and intimate tissues. These microvessels are very sensitive to pressure, inflammation, and lifestyle. The combination of slow breathing and pelvic activation creates a gentle pumping effect. The diaphragm pulls blood upward, the pelvic floor pushes blood through the region, and the gradual exhale prevents sudden spikes in pressure. Over time, this rhythmic stimulation works almost like an internal massage for the vascular system in the pelvic area. encouraging better tone and reactivity. Another important benefit relates to bladder and prostate comfort. Many men over 50 wake multiple times at night to urinate, strain to start the stream, or feel like the bladder never fully empties. These issues are not always caused by severe disease. Sometimes they are amplified by muscle dysfunction and poor coordination between the pelvic floor and the bladder. By starting the day with a gentle, intentional activation of those muscles, you improve their communication with the nervous system. Some men notice after practicing consistently that they can hold urine more comfortably, that they feel more in control when coughing or lifting, and that their stream becomes more confident and continuous. Stamina is not just physical, it has a powerful mental component. When a man trusts his body, he relaxes. When he doubts his body, he tenses. That tension alone can sabotage circulation and endurance. The 10-second habit creates a moment of deliberate control at the very start of the day. You feel your breath, you feel your muscles, and you experience that your body still responds to your commands. That simple experience can soften anxiety, reduce anticipatory worry, and build a quiet inner confidence. Over time, this confidence changes the way you approach exercise, work, and intimate moments. You are no longer waiting for your body to fail, you are actively supporting it. To make this more concrete, let me share a few examples from men very much like you. One of my patients, whom I'll call Mark, was 62 and complained that he felt used up by mid-afternoon. He relied on coffee to keep going and avoided intimacy because he feared not having enough stamina. We checked his heart, his blood work, and his hormones. They were not perfect, but they were not catastrophic. What stood out was his stress level, his shallow breathing, and his complete lack of pelvic awareness. I taught him this same 10-second habit and asked him to pair it with a short morning walk 3 to 4 times a week. After 6 weeks, he reported that his legs felt lighter, he needed less caffeine, and most importantly, he felt less worried about his performance. He said, "I feel like I'm back in my own body again." Another man, whom I'll call Daniel, was 58 and struggled with nighttime urination and a sense of pressure in the pelvic area. He had already seen another doctor and was told his prostate was mildly enlarged, but not dangerously so. Medications were an option, but he wanted to try natural support first. For him, I emphasized the same 10-second habit, but I also showed him how to repeat shorter versions of the pelvic floor activation while sitting at a red light or at his desk, always gentle, never forcing. He combined this with reducing late-night fluids and adding more movement during the day. After a few months, he still woke up at night occasionally, but the urgency decreased, his flow improved, and he felt significantly more comfortable. That comfort alone boosted his confidence and reduced the fatigue that came from fragmented sleep. I also think of a man in his 70s, whom I'll call Robert. He believed he was too old to change anything and was certain his stamina loss was permanent. When he finally agreed to try the habit, it was mainly to prove to himself it wouldn't work. However, he committed to it for 1 minute every morning. 6 repetitions of the 10-second pattern. He also started drinking a glass of water before coffee and added a few specific circulation-supporting foods to his breakfast. 3 months later, his words to me were, "I'm not 40 again, but I am definitely not done." He described walking longer distances without needing to sit, feeling steadier on his feet, and reconnecting with a sense of possibility in his intimate life. You may be wondering how to combine this simple habit with natural supports throughout the rest of the morning. One of the best ways to amplify the circulation benefits is to follow your 10-second stamina switch with a glass of water. Hydration alone improves blood volume and helps the heart pump more efficiently. If your doctor allows it, you can add a squeeze of lemon or a pinch of mineral-rich salt to the water to support electrolyte balance. Shortly after that, adding foods such as watermelon, beets, pomegranate, citrus, and leafy greens to your breakfast supplies, the nutrients your blood vessels use to stay flexible and responsive. For men who want an extra layer of structured support, certain natural ingredients can work alongside the habit. Compounds like L-citrulline and L-arginine help your body produce more nitric oxide, encouraging better blood vessel relaxation. Herbal allies such as ginseng, maca, and ashwagandha have been used traditionally to support male vitality, resilience to stress, and overall stamina. Minerals like zinc and magnesium play crucial roles in hormone balance, muscle function, and sleep quality. When combined in a balanced male vitality formula and used under professional guidance, these nutrients can complement the 10-second morning habit by supporting the deeper systems that manage stamina. It is very important, however, to remember that no habit, supplement, or routine should replace a proper medical evaluation when something feels seriously wrong. If you experience chest pain, sudden shortness of breath, severe fatigue that appears out of nowhere, pain or burning with urination, blood in your urine, sudden swelling in the legs, or a dramatic change in intimate function, you should not simply rely on breathing exercises. Those signs deserve prompt attention from a health professional. The role of the 10-second habit is to support your baseline, not to ignore warning signals. You may also ask how long it takes to notice changes. Every man is different. Some feel an immediate sense of calm, warmth, or grounding after the very first morning. Others require a few weeks before they notice that they can climb stairs more easily or that their evening energy is more stable. What matters is consistency. 10 seconds is so short that your mind will want to dismiss it as trivial. But in my experience, men who commit to this tiny ritual are often the same men who slowly build other positive behaviors around it: better sleep hygiene, lighter dinners, regular walking, strength training, and open communication with their partners. The beauty of this habit is that it returns control to you. You don't need a special device. You don't need an appointment. You don't need perfect circumstances. If you can breathe and gently contract your pelvic muscles, you can begin. You may still choose to take medications, use supplements, or follow other therapies. This habit does not conflict with them. Instead, it prepares your body to respond better by enhancing circulation, calming the nervous system, and engaging the muscles that so many men ignore until problems appear. So, let's bring everything together in one clear idea. The most important message I want you to remember is this: male stamina in midlife and beyond is not determined by age alone. It is shaped every day by the signals you send to your body, and the first 10 seconds of your morning are one of the simplest opportunities you have to send a powerful, positive signal. A single 10-second pattern of deep breathing and pelvic activation may seem small, but repeated over weeks and months. It can help restore circulation, support bladder and prostate comfort, calm the stress response, and rebuild your confidence in your own body. If you take nothing else from this conversation, let it be this: it is never too late to support your vitality. Whether you are 45, 60, or well into your 70s, your body still responds to the right kind of attention. Stamina is not a memory from your youth. It is a capacity you can nurture with smart, consistent, natural habits. The 10-second morning. Stamina switch is one of those habits, easy to remember, gentle to perform, and powerful in its long-term impact. Tomorrow morning, before you reach for your phone or rush into the day, pause. Feel your body on the bed, place your feet on the floor, and take that 5-second nasal inhale followed by the 5-second exhale with gentle pelvic engagement. Notice how you feel afterward, even if it's just a little more grounded or awake. Then, give yourself the kindness of hydration, nourishing foods, and a few minutes of movement. Over time, these choices become a quiet declaration. I am not giving up on my stamina. I am supporting it. Thank you for sharing this time with me. I'm Dr. Susan Parker. and it's an honor to guide you in these conversations about men's health and vitality. If this message resonated with you, I invite you to reflect on your own morning routine. What signal have you been sending your body at the start of each day? If you decide to try this 10-second habit, observe your progress, listen to your body, and be patient with yourself. And if you know another man, a friend, a brother, a partner, who might benefit from a simple, natural way to support his stamina, consider sharing this video with him. Together, we can break the myth that aging means surrendering our vitality, and instead, choose to age with awareness, strength, and confidence.